Welcome, everyone. We'll just wait a minute for everyone to come in before we start. Since it's only an hour webinar, I don't want to waste too much time, so I'm already going to start with the introductions while everyone is popping in. So good morning, afternoon, and evening for wherever you're joining us from. We're delighted to welcome you at this very exciting launch, namely the Toolkit on Trauma and Addiction for the Workforce, Families, and Communities. It's my great pleasure to moderate today's webinar on behalf of WFAD and welcome you and all our speakers, especially since our first launch webinar for TSAFI itself is an initiative in May, followed by our Myth to Action campaign, and now resulting in a Toolkit launch. It's a nice circle to be part of. And the next hour, we will dive into the background of the toolkit, its intention, and its practical implementations through our pilot. But with that said, I would like to give the floor to our Amy Ronshausen, the Executive Director of Drug Free America Foundation, to officially open today's webinar. Amy, the floor is yours.
Thank you, Cressida. And good morning, afternoon, and as Cressida said, maybe even evening for some of you. Welcome. It's truly a delight to be able to be here today. And this is a really big, I think, important milestone for this initiative. It's the launch of our Myth to Action Toolkit. And so we're just really happy to be here and to be able to do that. The Trauma and Substance Use Disorder Action Force Initiative, better known as SAFI, and I'm happy to finally be able to say it correctly, was created with a clear and urgent purpose to strengthen trauma-informed, evidence-informed, and compassion-driven approaches to substance use disorders across the workforce, within families, and throughout our communities. So today, as Cressida mentioned, marks the first public unveiling of the toolkit that brings this mission to life. The toolkit is more than just a guide. It's a practical and accessible and deeply needed resource that helps move us beyond the misconceptions and confusion that often surround these issues. And most importantly, it offers concrete and real-world strategies that anyone, providers, caregivers, frontline workers, and community leaders can start applying immediately within their lives and their communities. So during today's session, you'll get a first look at the toolkit, learn about early success stories from its implementation, and hear how this resource can help you in the work that you're doing to strengthen the community that you serve. I want to extend my warm welcome and my heartfelt thanks to all of our presenters here today for sharing their time, their expertise, and their insights, and for helping us really bring this initiative to the global stage. And especially to all of you who are joining us today, your presence here just shows how important this issue is to you. And we're happy to be able to support what you are doing and be a resource for you. So I'm just very grateful for you. Your commitment to building a trauma-informed response, a recovery, supportive environments, and that's what makes this initiative not just possible, but able for us to be able to use it in a very powerful way. So I'm just very thankful for that. So with that, it's my honor to officially open the toolkit launch of the Trauma and Substance Use Disorder Action Force Initiative from Myth to Action Toolkit.
Thank you, Amy, for this official introduction and this kickstart of today's launch. With that said, I would like to now introduce our very first speaker, Rocio Suarez Ordonez, who is a licensed clinical psychologist with extensive experience in trauma, substance use disorders research, and capacity building. And she also has been leading TSAFI the last couple of months, and she will provide insights in why and how the toolkit was developed. Rocio, the floor is yours.
Hello, everyone. Can you see my screen?
Yes, we can.
Okay, so we're launching the toolkit today. It's a great milestone, and I do want to share with you how all started, because I think it's one of the biggest strengths of this toolkit, because it shows that this toolkit came from you, and actually you made it. So when we started SAFE, we had a meeting and we said, okay, so if we want to give resources, we need to know what our colleagues, what members of the community are thinking about trauma and addiction. And we said, all right, let's launch a campaign. And we ask on social media, by email, what do you think about trauma and addiction? What do you hear about trauma and addiction? What are the myths you actually believe about trauma and addiction? And this happened. We started receiving myths. And one, for example, it says people who live a traumatic life become drug dependent. Trauma only comes from massive experiences. Trauma can be treated without first quitting addiction. And then this happened. They keep coming, 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 and coming until we received 52 myths from 13 countries across the globe. So this is quite a snapshot, right? And it's quite a challenge because actually what we started thinking is, what do we do with this? Because we know for a fact that what we think, our neural pathways, the way we think actually directs the way we see the world and the people, the way we relate to other people, the way we care to other people, and the way we prevent things from happening. So if we took one of the myths that I presented just before, it says trauma and addiction are not connected. Well, if we actually have that myth and we believe that, we could be in the field working with people that have adverse childhood events, that has trauma, and do not address prevention on substance use disorders. Why? Because we don't believe it. So actually, rewiring these misconceptions, it's incredibly important because if we don't do it, we will be missing out one of the strongest predictors of addiction, that is trauma. So what we did, we took all the myths, we converted into questions because we didn't want to reinforce the myth, and we gave facts. We took cognitive neuroscience, we took facts, and we say why they weren't correct and what was the correct thing to address things. And then what happened? We started having comments and engagement from people all around the world. So trauma is a hot topic and we knew about it. So when we talk about trauma, it seems like it is a hot topic, it is very important, but it's also like a ghost, a kind of word. We are scared of that, it's taboo. So I do want to introduce something else. So when we talk about trauma, we can also be talking about brain change. We can also be talking about learning process. We can also be talking about mental health and physical health. And if we talk about this, what do you think this all applies to? Also to addiction. They are both brain change, learning process, physical problem, and a mental health problem. So we knew that we needed to rewire these dangerous misconceptions. And when I was doing the slides for this webinar, I thought we actually need to rewire misconceptions all the time, right? So imagine, I don't know, you have a partner, a colleague, a friend, and somebody else comes and said something bad about that person. What would you do? What would you do? Will you believe that and change everything about the relationship you were having? Or you will challenge that new misconception? Well, actually, what you do with that information will change everything for you. So we wanted to rewire these misconceptions, and we said, okay, how? Well, let's address it, we said in Safi, but in a very specific way. It should be relatable, it should be easy, and should be evidence-based. And that is what we did. These are our 3 pillars. And that is how From Myth to Action Toolkit was born. It's a toolkit for, as Amy said, the workforce, families, communities, for actually everyone. And what we did was taking the myths, putting the myths as a question, as I said, we put who said it, from what country, and we give the facts. For example, look at this. The first one is addiction, are addiction and trauma truly related? Well, yes, we said. And why? Well, actually, up to 95% of people with addiction reported trauma. And we know it's one of the strongest predictors. And after the scientific facts, we wrote in every myth that we wrote 10 myths for this toolkit, a very short paragraph explaining based on neuroscience the myth. But what's more, we give some tips. So if you're dealing with someone with addiction, you can see down there in white that says, always assume trauma is present, even if it hasn't been disclosed. And if we need to assume that, we need to scream from trauma and for ACE all the time, because if not, we won't be able to prevent it or treat it. This is one example. Another example is, can children really experience trauma even at a very young age? The answer is absolutely yes. What are the facts? What's the science? We put it in the toolkit, and we actually explain in a very easy and relatable way why actually trauma in children could be more dangerous, could lead to substance use disorders, and how it alters the brain architecture, but it's in a very easy way. And if you can see the tips, you can use it whoever you are. You're a workforce, you're a family member, you're a community member. If you have a child that has experienced trauma, what you should do, name and validate their feelings, create safe and predictable routines, be there, and seek trauma-informed care. So like this, we did 10 pages from 10 myths. But we didn't stop there because, well, this is very personal, but I'm a very practical person. And I do believe, talking with a lot of people in the field, that we need to take what we know and put it into practice. So we created in the same toolkit at the end, guided exercise, but not just random exercises. We made exercise for every one of you. So you, if you're a person alone that you are struggling to understand about trauma and addiction, you can go through the toolkit, and actually we give you a couple of self-reflection exercise questions and notes you can do for yourself to put what you learn into practice. For your team and your organization. So if you have a team or in a treatment center, in a coalition that you want to work with this, well, we give you the toolkit, and also you will have an exercise step by step how to implement it. If you're a family member or a community, we also give you some tips and some exercise for you to implement. Also, if you're a policymaker, what we did here, we gave very specific information for policymakers and actually interesting questions for them to revise some of the programs they have and to see if they're actually trauma informed and how much money and how many lives they can save if they are. And this last one is another one we did for the teams and the community. And it's a little bit longer. It takes between 30 and 40 minutes to implement the exercise. We really thought about it. And you go through the toolkit, and then you go through this exercise that has very clear steps. And you also have a participant worksheet. So imagine you have a team with 10, 20 colleagues. Well, you give the participant sheet to the 20 colleagues with very specific questions. The good thing is that with this, you will get a result. But we don't tell you what result you will get. We just give you the resources, the trigger questions for you to think what is happening in your center, in your coalition, in your institution, for you to create new resources with the resources you already have. And I'm very happy because when I presented this in a call, Chantal Pepper, that's going to present now, she said, I love this. This is one of the things we need in the field. And that is why we actually started launching, and we didn't stop here. And we said, okay, let's launch one more thing. Let's launch the pilots, because we wanted to know if this actually worked in the field. Was this suitable for all? We didn't know. We needed to see. So we launched some pilots. We did it in South Africa, we did it in Pakistan, and we did it in Argentina. I will share the results later because everyone that made the pilot completed a scan code, some questions. So we do have the results. We have quality data to give you to what are the results. But one more thing, we didn't stop there as well, because we said, okay, we have the toolkit, we have it in English, we have it piloted. What else? Well, we want to get to my people, so we did it in Spanish. So we have a free toolkit with guided questions in Spanish and English, and I couldn't be more proud of this. So this is the sneak peek. You will have the link and you will be able to download it for free at the end of this webinar.
Thank you so much, Rocio, for that great introduction, and also just showcasing so clearly how it came about and that it was really a collaborative effort among all the members really that contributed. And then also, again, which we will go into now, all the persons that volunteered, all the great advocates here that volunteered to pilot it. So it's really amazing. So with that, I want to move on right away to our first team that piloted it, Chantel Pepper and Roy Stuurman, who they piloted it in West Cape, South Africa. So Chantel Pepper, she's the chair of Western Cape Substance Use Forum, and also works for the Western Cape Government Department of Social Development. And Errol Stuurman is currently working as a generic social worker at the Department of Social Development in Riversdale. And he's also the substance champion for his service delivery area. Thank you again. And please, the floor is yours.
Thank you so much for the lovely introduction, and Rocio and Amy as well. I really think that it's because of Rocio's passion as well. And we basically aligned in terms of how do we get, because I'm a policy implementer. So it's how do you take policy and toolkits and so forth from, the top to the ground. And I think that's where our conversation started. And I said, please, I am very willing and happy to pilot this for you, because working within the field and the communities and closely with the municipalities and my colleagues at social development in the ground, the social workers, it really, these sort of toolkits really will make impact. And we already saw it in our training. It was actually a universal recovery training that we did initially. And then during the time, Rocio said, well, are you keen to pilot this? I said, yes, please, because when I went over the toolkit, it just made so much sense to add it. And I'm so grateful and thankful for Rocio for just, and the team, like Rosida and everybody for the support, for developing the toolkit, because it's really, how do we get this information to the ground? And I just want to share some pictures for you, because during the training, we had really a diverse group. And we partner up as provincial government. We partner up with our municipalities across the province, with their stakeholders and their communities. And this is how we work from the bottom up approach. And the toolkit really speaks to the people when we started doing the training. And I think when Alro speaks to this, you can see there were NPOs, community activists, including mothers and a father that with lived experience, community development officers, as well as our colleagues from DSD, social development, social workers that really are in the trenches daily. So I really would just like to say thank you to Alroy for really taking this on. And really, he's the champion on this, because he's actually continued it after the initial training and pilot. So well done to you, my colleague. As you can see, the ladies were busy, and we did it at the municipalities, two-song center, they call it. It's the one-stop shop. And, that's what partnership looks like, so that we can actually utilize spaces that is easily accessible for the community, so that we can actually capacitate them and empower them. So the next slide you can see, it is also the... Okay, so the next slide, I'm not sure what's going on, but okay. There we go. Okay, there it is. I just want to go back quickly to apologize. Okay, I think I've now ruined it, but okay. You saw there at the end that Alroy was actually the person that was implementing the actual pilot, because we did it across 3 municipalities. And I just want to highlight that the toolkit really made an impact within that group that we actually when we conducted the training, and it was really so outstanding that Alroy was able to translate. Because remember, in our settings, we've got 11 official languages, but the area we were covering is predominantly Afrikaans and not English. So therefore, Elroy had to think on top of his head, and he actually was so amazing that he actually was able to translate, the English version to, and there's your proof. He literally had to write it out. So that the group and the ladies can understand, because Afrikaans, like I said, is their first language. And it really made a massive difference for him to be able to do that on the spot. But again, it was still it was really impactful and a lot of lessons learned. So I just want to hand over to my colleague Alroy, and I just want to say this will definitely be included in the actual support groups moving forward, which not even includes just the people in recovery, but it also is the community activists, the community members, mothers, fathers, everybody. But Alroy will give you more overview of that and his experience as the social worker representing Department of Social Development on the ground. So over to you, Alroy. Thank you so much for being here, my colleague. I really appreciate it.
Thank you very much, colleague. Wow. I'm just so thankful and grateful to have this opportunity to be part of something so great. And thank you also to Rochelle that invited us to do this. And in the beginning, I wasn't really aware of what I'm signing up for, but then I also got the information, and by piloting that, during those sessions, my mind was blown. And despite the fact that we had to translate, it was like you do it from the tip of your tongue, and people were understanding, people were engaged in that. And I know it's challenging to work in the substance use disorder field. A lot of professional social workers also are not quite up for the task, because it gets specialized in a way. And you have to have certain skills, because those are some of the people that actually get judged a lot for what they are doing and why they are not leaving substances behind and just working on being positive in their lifestyles. So I had to think critically about this also, and that to me was thinking about, what, I need to start with myself as well, because I also have preconceived ideas of what my values is, and how I transfer those type of things to other people unknowingly sometimes. And that's where the empathy and the worth and dignity comes in with regards to working with these clients. And I must say, the field is open for me as well, because this was basically a gateway to have the conversation about the difficult and hard topics. Sometimes when you sit with a client one-on-one, it's difficult for a therapist or a social worker, or a lot of social workers, let me not do that now, to start the conversation on how can I start talking to you when there's already a sense of resentment and, a dearth between the two of us, especially when it comes to trauma. But this basically opened the door. When I had my first session, I decided, you know what, I'm going to do this now today. And I did it with a sustainable livelihood beneficiaries here in Riversdale. And a lot of them is primary school level education. So they don't understand, English is not their first language. So it was not difficult to translate it, but the moment I started bringing it down to their level and explaining how we see it day to day, that actually opened the field for them. They started engaging, they were talking, they were giving feedback and all of that. So that to me was awesome. And then I decided, you know what, this is going to be my thing now. Because I have a lot of support groups. I have 2 that I'm running at this moment. So we've done a lot of stuff there, and it's been going on for the past 3 years. So for me to bring that also to them, we've discussed a lot of things. It opened one particular myth, and I think it's the second one. Does trauma and addiction, are they connected? So when I asked this question to the group members, they were able to discuss it, and one group member gave feedback. And she actually said her own experience of how she was sexually abused and almost she was almost killed by a family member. And the fact that she was able to share it with the rest of the group, gain that understanding. And that to me was very special, because now she's never said that story in an open setting like that. And I was also able to tap into the healing process and commend her for that, because it also starts with, I'm able to talk about this now. And now this actual group and this tool gave her the opportunity to share her experience and, empower other people as well, because there was different groups of people in that session also. So that to me was very special. And the information is straightforward, and it's things that we see every day. It's things that my family members go through. It's things that community members we see every time. And the importance for me is now that we need to continue with this. I want to continue with this. I need to empower my colleagues also to implement this. And I think we have a lot of platforms, especially here in the Western Cape, and good relationships with our stakeholders, where we can actually say, you know what, this is a tool that's actually very helpful, and it's easy to implement, it's practical, and it's very understandable for the people. So you guys can do this. This opens the floor to so many questions, child protection, substance use disorders, older persons even, all these different programs. And at the end of the day, this is also my opportunity now to say, you know what, I'm not in a box anymore. We have a lot of tools, and you tend to focus on, what, this is going to work for this group, this is going to work for that group. But this, it seems like it's an all-in-one type of toolkit, where you can open really the conversation for everyone to take part in it. So that to me is very special, and also to engage in the potential therapeutic approach, because substance is the means to the end at the end of the day. People don't wake up one day and they want to be a substance user, and many people sit with substance use disorders and they don't know where it comes from. And that to me is my opportunity to engage with them, to give them a background on, what, this happened to you. And this is the reason, this is possible causes of why you are prone to exhibit these type of behaviors. And really, I'm very excited to continue with this project. And I want to thank you, Rocio, and the rest of the group, Cressida and them, for making me part of this. And I can really see how people light up when they are able to engage. Sometimes we as social workers or as therapists stand in front of a group of people and we do the talking. But with this type of tool, you can actually get them involved, and they can look at their own lives and get that insight into why things are the way they are. So I love the substance field, and I love working with people, though we are working generically, but this can also be a tool that I can implement, like I said earlier, in different programs that we are used to. So thank you very much for that. Okay.
Thank you so much. That was incredible. It's incredible to hear how, how it has been such a positive experience for you to use the toolkit in your personal work, but also in your personal life, to reflect on yourself, like you said, and that you see such a potential, and also that for others to be engaged. It's really inspiring, since working on it, you don't really know how to imagine it, how it can be helpful to others. So it's so nice to hear that it has been so helpful to you, and hopefully it will be continuing to be helpful for so many.
Thank you.
So with that, I want to tell the audience also that you feel free to ask questions. Do put them in the Q&A. We'll have some time for questions at the end for any of the experts, and so yeah, please do share them. So with that said, I would like to move on with our next person, who has also been implementing the pilot in Pakistan. We are joined by Sana Ularator, and he's a consultant in drug rehabilitation for over 3 decades of experience in drug demand reduction. He founded the Pakistan Youth Organization and the Mian Afzal Trust Hospital for drug treatment. Sana, the floor is yours.
Thank you very much, Cressida, and hello everyone. First, I would like to congratulate the World Federation Against Geography America, and especially Rocio for their outstanding work on the trauma toolkit, Myths to Action. And it's my pleasure to share my experience with the toolkit, which we piloted at the Mian Afzal Trust Hospital and Freedom Treatment and Rehab in Pakistan. The treatment professionals took keen interest and successfully implemented the toolkit. At first, we conducted a pilot training, which facilitated by me and my colleague Saharish, uh, under the supervision of, I can say, the Rocio. He also supported all the time to us. And this training was conducted by the math in collaboration with the TOSAFI. And one thing which I really need to mention here, that as the earlier the Rocio mentioned that the myths received from the different countries, that I feel that the unique highlight, it is the collection of myths from the different countries, showing that these misconceptions are the globals and not limited to one region or a culture. When we began the pilot, I was really impressed by the toolkit approach uh, of challenging assumption and turning myths into concrete actions. The pilot was really a learning experience for me and my team. And I think that we applied the tools in the real world setting in the Mian Afzal Trust Hospital and Freedom Rehab. And we received the overwhelmingly positive feedback from the professionals, from the other people, and the interactive testing and reinforcement process added a great value. And it's clear how the toolkit has evolved based on pilot insights. One of the most impactful aspects was its ability to foster critical thinking and collaboration. The resources helped us identify and challenge our own biases. That is another thing, leading to more effective solutions. For example, an exercise reframed a long-standing issues in a new, innovative way, results in a more efficient outcome. I think the pilot also underscored the importance of feedback, and we provided the input on contact structure, usability, the feedback from the team, which will be helpful in shaping the toolkit further. Hopefully, the final product will reflect those the contribution from our team. And in the end, I would like to say I emphasize the value of myths to action toolkit brings the organizations and individuals seeking change. I encourage the our other colleagues from around the globe which attending this webinar and other people to encourage to explore it and consider how it can be applied in your own settings. And this one is also opportunity to thank you, Cressida, for the opportunity to share our thoughts, what we felt in the uh, pilot and how we piloted in our facility. I also believe that it will be a valuable addition to the substance use prevention and treatment field, especially in addressing trauma. And I would like to say everyone, they may be apply in their own setting, will be helpful to address the trauma. So these are something which we piloted in Pakistan and we shared with you all. Thank you.
Thank you so much, Sana, for your contribution and sharing also how how it worked for you and your team. And it's so great to hear that you have also experienced such a positive outcome and you would encourage everyone else to, implement it also. Um, With that said, I would like to give the word back to Rocio, who has also implemented the pilot in Argentina, actually. And so, yeah, the word is to her, and also to share a bit of the results that, you saw afterwards.
Thank you. So I am sharing my screen. Yes, do you see it? Okay,
Yes, I see it.
this pilot was in Argentina. We use, of course, the toolkit in Spanish. I worked with 22 people. This was an NGO that works in a very, very vulnerable population, a very vulnerable neighborhood. I actually conducted myself a research on this neighborhood last year, where we concluded that 2 out of 3 women were having gender violence issues. That's double the world fact. So you can imagine how important it was to actually train this NGO on this matter. What I did here was I presented the toolkit. We went through every myth together. Everyone was there, directors, the admin people that were in contact with the benefits, and the people that needed assistance. Everyone was there. I mean, actually, even the cook was there. The people that were opening the door was there. Everyone was there. That is to be trauma informed. And that is why 22 people of one organization was there. And I went through the myths for like an hour and a half, for more or less an hour and a half. We talked, and then at the end, what we did was doing one of these exercises. All the pilots did the same exercise, so that's why we have the results. And as you can see in the pictures, what we had is people coming together and saying, okay, so we need to be more trauma informed, but how can we show that we are more trauma informed? Okay, let's write it. Let's put signs. Let's put things on the wall so people actually know that we are trauma informed, because they work with children, with adolescents, and with adults. So as you see in the last one, we did actually they did like a sign where you can actually choose how you feel. You can choose the face, how you feel, and you can introduce the way you're feeling. If it's dangerous or it's uncomfortable for you to talk about it, you can just point at the face and people will understand what you're going through. So that was very good. And then I didn't stop there, and we did another pilot, but this time the pilot was with the community. So this was the community that were youth, especially. They have 25 people, and they basically all are undergoing trauma because of the living conditions that they have. Very high violence rates, very high sexual abuse rates, and very high addiction rates. And what is interesting is, as you can see in this slide, I made one flyer and I said, okay, so are addiction and trauma truly related? Again, this question appears, and it's one of the most important questions. Sana mentioned it, I mentioned it again. Are trauma and addiction related? That's what the sign is saying. And I put yes, that says C, and no, it says no. And I asked them to put stickers, what they think. And look what won. They said no. Trauma and addiction are not related. And they are the community. They are the ones that are suffering from it. And they have no idea. So this was groundbreaking. Imagine when we actually went through the toolkit, because this was at the beginning. And then at the end, we went through the toolkit. And everyone was like, okay, so they are related. So they started understanding their own stories completely different. And as the same institution that I trained before, they knew they were trauma informed. They had a capacity building on trauma informed. They went to that NGO and they looked for help. So it's like we closed the perfect circle. And I want to say in their own words what they've been trusting us. And one of them said, I understood it from a different perspective, trauma and addiction. It clarified many doubts for me. Thank you. And then one of the colleagues said, this information needs to be shared with more institutions. Why? Because she later said to me, I work in different institutions, but you know what? Nobody's talking about it. So we need to put this capacity building. We need to put this toolkit out there. We need to talk about it, because actually having the cognitive science behind trauma and addiction is how we can change everything. And then this last one came from a community member, and she said, and I don't know if it was a woman of a man, because it was anonymous. It says, what I like the most about the kit is the message, because I think it breaks through prejudice. So when I read this, I say we did it, because if we can actually break through prejudice, we can change things. So I couldn't be more proud of this. And just to conclude, I want to share the feedback of all the results. We analyzed it. We had 46 people in total between Argentina, South Africa, and Pakistan. This is just the workforce. It does not include the community. And as you can see, 100% of them said the toolkit clarified common myth. Again, this was anonymous, so they could actually say whatever they wanted. 92.9% of them said they had a shift in perspective of how they saw things. 100% of them said, yes, I would definitely recommend the toolkit. And then in a scale from 1 to 5, being 5 the highest, let me just move this because I cannot see the number, 4.57 out of 5 said, I will apply what I learned in my work, but also in my personal life. And 4.24 out of 5 say they would reuse the exercise with somebody else. So these are the results. This is hard information that we have for you. So we can see that we tested in very different populations, given different languages, and everyone is saying it's working. So I couldn't be more happy and more proud. And this is now free for you to download and use. If you have any questions, you can send us questions, you can send us messages, anything that you like, and we can help you. And then please, we will share the link. So just go there and download it either in English or in Spanish. Thank you.
Thank you so much, Rocio, for sharing the experience in Argentina, and also sharing the great results from basically all around the world. And that it's what also everyone already said here, and it was reiterated that it has been such a positive experience, and that it would be very easy to be reused. I've shared the link in the chat, so everyone can now, or like after we finish, of course, bear with us for another 10 minutes or so. But please do go and visit the link. We will share it also in the email that we will send to all participants after we have finalized the webinar. And then we just really encourage you to download it and also spread it among your network. The more the merrier. As we said, it's free. We did not want to put any barriers for people using it. So that's why we keep it open for all. If you have any questions, please do share it in the chat. We still have some time, but I did also have prepared some questions for our dear panelists, just from your experience a little bit. I mean, most of it you have already said, but I think one of the questions that I would have is that if you give one piece of advice to organizations just starting with the toolkit, what would it be?
Who want to go first? Okay, I go first.
Elroy?
No, go. You go, Chantal.
No.
Go.
I think Elroy will be the best person to, because I'm putting you on your spot, colleague, but I think.
No, I didn't quite get the question now.
All right, I can repeat it again. So if you
Okay,
could give one piece of advice to organizations just starting with this toolkit, what would it be?
Get the normal people from the ground, and just bring it, like make it easy for them to understand, and what I find also was that a little self-disclosure for me, like linking my own experiences to the myths, and seeing what is happening in our community, that helped a lot. So I think it also breaks the way for people to connect more with you. So that for me was in part one of the things that is very helpful in the end. So yeah.
Thank
And
you. That is
one other thing I would say is we did it relatable for a reason, because when we feel that we are something is being touched, something that we think that or we hear or we know that is happening around us, we pay more attention to it. So if we know, for example, that someone in my family, in with my colleagues say, "Oh, no, trauma and addiction are not related." Well, actually they are, right? So we actually the toolkit start with questions, but with questions that come from the field. So if you just say, I don't know, 2 or 3 myths, someone in that room will at least think, yeah, I know that. I think that, or I know someone that actually thinks that way. That's for sure.
Yeah, most definitely. And I also think that many times we as professionals find ourselves in a position that we actually enable these type of myths, because of our lack of knowledge and insight with regards to that. And that can be very harmful. So yeah, you need to be aware when you are presenting this and when are you bringing it to the community or the people, that you need to be aware of your own ideas and values with regards to the myths, yeah, and the facts of that all. So yes.
I also encourage anyone that is listening to this, if you have any questions about how can you actually put it on practice to yourself or your team, just write it on the chat, or then if you want, you can write us a text.
great.
I think,
Sana, you would like to share?
yes, as our colleague mentioned different advances, and then I would like to say that at first it is someone known to use the toolkit in their practice. They must start from smart and then they apply to the others. And one thing that is they also need to keep in mind their in which country they are applying. They need to consider the cultural values, as well as they also keep in mind that the language should be the appropriate, and because we are applying that people that might be they have having the trauma, so that the language is also the appropriate when we apply this tool. Thank you.
Thank you. Yes, like you said, it needs to be culturally appropriate. And I think that was already in a way mentioned by everyone here, like how Elroy has translated on the spot in Afrikaans, and also how Rocio, the toolkit, was translated in Spanish. And hopefully, this translation can happen in many more contexts, and also not just the language, but also the cultural adaptation, of course. And what you said, language, when speaking with people facing addiction or facing trauma, language can be a very strong tool, but it can also be a harmful tool. So it needs to be we need to be very much aware what language we're using. So yes, thank you for bringing up that point. Rosie, would like to add anything to the
No, I think
question?
any questions? Actually, when I was listening to Elroy, what he was saying, it really touched me. Really, I want to disclose this to everyone that is listening. It was very hard work doing this toolkit, but when you see that it actually goes to the field and it could change people's life, because remember that I always say the same thing: how we think and what we think actually directs what we do. And we know for a fact, because this is science, that trauma is one of the most important predictors of addiction. So basically, we cannot prevent addictions in a great way if we don't address trauma. So I think this is one of the first toolkits that makes maybe this easier to do. So I'm very happy.
Yes, exactly. Very on spot. We still have a little bit of more time left, so I think I will ask one more question before closing. Also, another open one. I know it might be a little bit repetitive even, but we've talked about it a lot already. But what do you think, what barriers exist in your context for having open conversations about trauma, and how might this toolkit help? I know it has already been touched upon, but like just to list one or two barriers that you've faced and that this toolkit might have helped.
I do want to address this because what I know and what I hear, I think I said this, but I will repeat it, is the misconception that is around trauma. So there's still think this is a woo-woo thing, it's still just a mental health problem when actually it's not. It's a neurobiological issue, and it actually impacts our brain and our body in ways that many diseases does, but we're not talking about it. So my experience is anytime I talk about trauma in a neurobiological way, everyone shifts perspective because they understand it different. It seems like, okay, now it's important. Well, yes, it's always important, but I think that the neurobiological shift and perspective we put into it shifts everything. Remember that what changed everything for addiction treatment was the neurobiological perspective. That changes everything. When we had the MRIs that said, okay, addiction changes the brain, it's not a moral issue, it's a brain issue, it changes everything. So at least what I want to do is the same thing for trauma.
Thank you. Would like to add, Sana?
Thank you, Cressida. As the barrier one, we try with, so maybe they not share the thing that due to the stigma or the fear of the judgment. So that maybe the professional also keep in mind how we can uh, work with their client or someone. So that's I think.
Thank you. Any final words from you, Eroy or Chantel?
I mean, I think I've said pretty much, before, but I really just want to say thank you to Rocio because I think, in our settings and our history and, as a country, trauma really is intergenerational trauma is one of the biggest barriers for everything and anything we would like to achieve within our country. And I think with this sort of toolkits and people's perceptions changing and understanding that trauma is the underlying, really one of the biggest drivers for everything, for crime, I mean, it just touches everything. And I think this is a great way to start and empower us as professionals from the policymakers right down to the social workers and therapists and registered counselors, because we always seem to miss them as well, the registered counselors. And I really do feel, and I'm excited to really just use this and share this and really kind of mobilize everybody because it really educated myself. And we never really had the words. And I think I just want to say thank you so much for Rosia for really have this vision because we need people and professionals like you so that we can actually have the words and the tools to empower our communities so that we can see the change because our communities are beautiful. They're beautiful, good-hearted people, majority. And I feel that they all need help as well as we do. And I really feel that this toolkit is the step in the right direction. So I just want to say a big thank you. And you can rest assured it will be part and parcel of our toolkits moving forward. So thank you so much for this opportunity as well. Thank you.
You're gonna make me cry. You're gonna make me cry. I know. I'm grateful. Thank you for your words. Really, they mean a lot, a lot. And I think Cressida, I think she said the best final words. What are your final words?
No, I think you took it all out from me, Chantel. So thank you so much. I just want to see if Roy, if you want to share any final words as well on top of that, or that just set the bar so high that we are just all
No, guys, I won't be able to top that. But thank you for everything, and thank you for making us part of this. And I'm a firm believer of everything happens for a reason. So yeah, Chantel and I have known each other for a couple of years now. But it's only the past 2 years that we've actually started working like closely together. And I believe that this opportunity is really the start of something big. So thank you for that.
Thank you so much. So with those beautiful words, I just want to thank all of you for being here with us today and sharing your experiences and just implementing it as well as it was a pilot. We learned from you a lot, well, because your feedback was incredibly important for us to, finalize the toolkit as it is right now. But also, of course, everyone, thank you for everyone who joined us here today as participants for being interested in this topic and for wanting to make this world a better place and integrating this into your work life. So we really encourage you to download it and to share it among your network and to make sure that this is a consistent part of the conversation, not a one-time thing. So thank you so much to all, and thank you also for Amy for being here and our supporter for Drug Free America Foundation. And yeah, keep an eye out, and we will share these recordings. We'll share a little bit of the summary and the details later on. So for now, wishing you a wonderful day, and we'll stay in touch. Thank you so much.
Thank you.
Thank you, everyone.
Bye.
Thank you so
Bye.
much.
Bye
Have a
bye.
blessed day further. Bye
Thank
bye.
you.
Bye.